So I'm Mike Stockdale, and this is Rich again, and this is going to be the second half of my health assessment. For overall appearance, the patient is well-groomed, has good hygiene, and is appropriately dressed. Can you tell me your name, today's date, and where we are?
My name is Richard. It's September 27, 2017. I'm in Falls Creek, Pennsylvania.
Oriented to time, place, and person. He also responds appropriately to questions. I have 4 objects in front of you. Get a good look at them, and I'm going to ask you if you can remember what these 4 objects are in 10 minutes. Okay? Okay, I'm just going to ask you a couple questions. Can you tell me if a kitten is to a cat, a puppy is to what?
Dog.
Okay. And can you tell me what this means to you? People that live in glass houses shouldn't throw stones.
People should make accusations.
His thought process and abstract thinking are intact. Okay, I'm going to have you do a little bit of math for me here. Can you subtract 6 from 30 until you get down to 0?
24, 18, 12, 6, 0.
Okay. He is able to correctly answer mathematics. And I'm going to have you write something down for me. Can you write, "Good morning, have a nice day"? The phrase is written correctly with no errors. Okay, I'm going to read you 6 numbers and see if you can remember them. 16, 32, 22, 8, 15, and 13.
16, 32, 22, 8, 15, and 13.
His immediate recall is intact. Okay, remember those 4 objects that I showed you earlier? Are you able to repeat them back to me?
Watch, thermometer, pen, and remote.
Okay, patient's recent memory is intact. I'm just going to feel your chest here now, feel for your heart. I'm just going to see if there's any abnormal vibrations. I'm now feeling the apical impulse at the 5th intercostal space of the midclavicular line. Can you turn your head for me? To the side. The apical impulse and carotid pulse are synchronized. Okay, I'm just going to listen to your heart now. Heart sounded good with no sounds of abnormality or murmur. I'm going to listen to your heart sound. I call S1. I'm going to have you take a deep breath, exhale, and then hold. Go ahead. S1 was able to be heard with, it was high pitched and had moderate intensity. And I'm now going to listen to S2, have you take a deep breath and hold. S2 was also able to be heard and was high-pitched. Okay, so I'm now assessing for jugular venous distension, which I do not see any. Now assessing the hepatojugular reflex. Okay, I saw slight signs of jugular venous distension upon palpation. When released, it had dissipated. Now I'm going to assess the carotid pulse. Carotid pulses are palpable, +2 and strong. Take a deep breath and hold. Okay. Same thing on this side. No signs of bruit were present. Okay, I'm just going to feel your arms and your legs here. If you feel any pain, let me know. Okay. Check your pulses. Okay, brachial pulses are +2 and equal. Radial pulses are also +2 and equal. Okay, and I'm going to feel your legs here. Same thing, if you have any pain or tenderness, let me know. Just going to check the posterior tibial pulse. Okay, pulse is +2 and equal in both legs. And dorsalis pedis, also +2 and equal. The abdomen is round and symmetrical in shape. There is no distension or bulging. Can you take a deep breath and hold it for me? And relax. Can you pick your head up for me? On manipulation, the abdomen still has no signs of bulging or any sign of muscle separation. Okay, I'm just going to listen to your valve sounds. Okay, and the valve sounds are present in all 4 quadrants. I'm going to now listen to the vascular sounds starting with the aorta and moving to the renal arteries. Iliac arteries. And the femoral arteries. Okay, no vascular sounds are present. There are no signs of brewing. I'm not going to percuss the abdomen. Sounds of tympany were heard over the small intestine and stomach, and there were sounds of dullness over the liver. I'm now going to assess for liver span. Liver span is 9 centimeters, which is within normal range. I'm now going to percuss the spleen. Okay, spleen is located between the 6th and 9th rib, which shows no signs of enlargement. Okay, I'm now going to palpate your abdomen. Just going to press lightly at first. If you have any pain or tenderness, let me know. Okay, I'm going to press a little firmer now. Again, if there's any pain or tenderness, let me know. Okay, abdomen is soft and there are no signs of masses. Now I'm going to palpate for your kidney. And have you take a deep breath for me. And exhale. Kidney was unable to be palpated. I'm now going to palpate your liver. You will feel some discomfort, but you should not feel any pain. Okay? Take a deep breath for me. And relax. Liver was smooth with no bumps, lumps, or nodules. I'm now going to test the abdominal reflex. Abdominal reflex is intact. It's with slight movement. Now I'm going to test the range of motion. Can I have you turn your head side to side? Look up and down. Okay, can you touch your ear to your shoulder? Okay, and you rotate your arm in a circular motion. Okay, and the other arm. Can you put them both out to your side? Bring them both forward and back. Okay. Next, I'm going to have you lean to the side. Okay. Can you lean forward and twist to the side? Okay. you straighten your leg for me? Okay, and bend it back. Okay. With your hands, can you move your fingers all around, rotate your thumbs, make a fist? Okay. With your feet, can I have you wiggle your toes? Any stiffness or anything in any of the joints?
No.
All joints appear to move smoothly with no limitation. Okay, I'm now going to assess the facial nerve and the glossopharyngeal nerve. Can you raise your eyebrows for me? Can you wrinkle your forehead? Can you smile without showing me your teeth? Or puff out your cheeks? And close your eyes very tight. Those seem to be intact. Assess the spinal accessory nerve. Can you shrug your shoulders for me? Okay. Turn your head to the left and to the right. Okay, the spinal accessory nerve is intact and muscles are strong. And the shoulders shrug symmetrically. Can you open your mouth for me and stick out your tongue? You say ah.
Ah.
Okay, you rises when he said ah, tongue out. Move it side to side, up and down to touch your nose and your chin. Cranial nerves 10 and 12 are intact. Now I'm going to have you follow my pen light here. Up. Okay, cranial nerves 3, 4, and 6 are all intact. Your nose. Your nose. Okay. And now put your arms out and touch your nose back and forth. And faster. As fast as you can. Okay. Patient is able to perform rapid active movements and fast as you can. Okay. And the other leg. Okay. Rapid active movement in the legs is intact. The heel moved in a straight line with no deviation. Patient is able to point to the stimulus without difficulty.
Dull. Sharp. Dull. Sharp. 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 Dull.
Patient's sense of sharp and dullness is intact.
Why?
A 2-point discrimination is about 3 centimeters. Tell me if you can, what you think this is.
Bottle cap.
Okay. Now with your left hand, can you tell me what this is?
Pen cap.
Okay. Patient is able to identify objects in hands with his eyes closed.
H. Yes.
Okay. And the other hand.
C. G.
Patient was able to identify the number or letter that was written in his hand on both sides.
Down. Up. Neutral. Up. Down. Neutral. Down. Down.
Patient is able to tell which direction his fingers being moved with his eyes closed. Okay, I'm now going to test right patellar reflex. Going for the tendon. Okay, reflex is present. Left patellar reflex is intact. Okay. Achilles reflexes are intact bilaterally. And this concludes my second health assessment. Thank you, Rich.
You're welcome.